had spent my first day in an insane asylum, and I was sure I didn't like it. Everybody looked all right, but I had been there long enough to know that most of them were as crazy as loons.
Today we are at the Oregon State Hospital Museum of Mental Health, which is located on the campus of the Oregon State Hospital, built in 1883. The museum is to show people the history of the treatment of the mentally ill, and also the progress that we've made and the progress that we still need to make.
It was a temporary insanity, I suppose, brought on by several factors. I'd been working too hard, doing brain work, and not getting sufficient exercise. I'd lived in a small room, cramped and low-ceilinged. I imagine I had a case of claustrophobia, the maddening feeling of being walled in on all sides to help the breakdown along. Finally, it was decided that I should be sent to the state hospital.
The room we're in now is called the Why Am I Here room, and it tells the different kinds of diagnosis that people would have received to admit them to the state hospital. And some of them are pretty unusual. People who had venereal diseases, syphilis, people who had epilepsy, meningitis, people who had alcoholism disease were all admitted to this hospital at one time. I think this institution was a place where people were sent when they had some kind of an ailment that wasn't considered a standard gallbladder, tonsillectomy type of issue, and when they really didn't have a good way to heal it. This dear lady came over from England and came to Missouri in the early 1800s, and then came across on the covered wagon. And she was admitted because she had melancholy. Well, shoot, I think all of us would have been a little melancholy from that experience. And she also had neuralgia, and she spent the rest of her life in this institution.
Here I am in an insane asylum, a place some people refer to as the booby hatch and the bug house. The surprising thing is that I don't feel too badly about it. I came here not too willingly, and though I look forward hopefully to the day when I can walk forth again entirely free, it isn't as bad as it's cracked up to be. It's no bed of roses either.
The original state hospital was built on this site, was considered out in the country in 1883. In fact, it was about 3 miles from downtown Salem. And its site was chosen because it is a little bit elevated, and it has a beautiful, beautiful scenery around it. Dr. Thomas Kirkbride was a physician in Pennsylvania in the early 1800s, but he also had a very keen interest in the buildings. He felt that the buildings were a part of the healing process for the mentally ill, and that those buildings should be something that were very visible and very attractive.
Sometime during that first day, I had a conference with the doctor on the ward. I didn't behave very well and didn't answer his questions, but rambled on about whatever came into my head. After I had finished the conference with the doctor, I went back to my room, and almost immediately this fine-looking young fellow, also a patient, popped in the door. He gave me some very good advice. He said, "You do just what the doctor says if you want to get out of here."
This would have been the typical size of a private room in this old Kirkbride building. It's an individual room with one bed, and it's about 10 by 10. And the one distinctive thing about this room is the window, because again, talking about Dr. Kirkbride's philosophy that we have a window that looks out on a beautiful scene. In this original Kirkbride building, the patients would have had their own room. As they added buildings onto this, they created double rooms, and in some cases ward rooms that would have been, of course, much larger.
Some of them scream, but you soon become accustomed to that. Some talk incessantly, often choosing nighttime for their loudest tirades. Lying in bed, I was quite despondent. I had little hope and was greatly discouraged. I was bitterly unhappy that this should have happened. I suppose I was accusing myself, which may have been the major element in my condition. I had worked so darn hard that I had made an awful mess of things.
After Dr. Kirkbride's philosophy, folks began to look at more of a medical intervention, and so we move into things like hydrotherapy. Hydrotherapy is just like we do now. It's a wonderful spa. It's a relaxing the warm waters that were controlled by this big instrument here that calmed patients down and made them feel quiet. There also was insulin therapy, insulin shock therapy, which they no longer use, but it certainly induced a seizure that would supposedly calm the patients down. The table behind us would have been used for probably lobotomies, and they were done on this campus, but they were stopped in 1968. They took the frontal lobe was destroyed by an instrument that looked like an ice pick that was inserted through the occipital lobe of your eye, and literally it was destroyed. So most people who that had to have that done were extremely agitated and uncontrollable, and pretty much it left them not in a vegetative state necessarily, but in a very, very different person than they were before, very calm.
What's that?
This will keep you from biting your tongue.
Oil?
Now just bite down on it.
Full.
That's right. Just bite down.
Huh?
Now bite down on it.
Good.
The movie One Flew Over the Cuckoo's Nest, which, by the way, won 5 Academy Awards, was shot here in 1975. In the Cuckoo's Nest, they did use electric shock treatments, and again, that's still used today, but in a modified form. And it was a controversial movie. It's a controversial book, and the plan to have it shot here on campus was also extremely controversial. There were some in the legislature and some staff doctors that felt that was not a good idea. Dr. Brooks, who was superintendent then, had a different idea. He felt that it would be something that would boost the image of mentally ill, and also he knew that the story itself was an allegory. It wasn't true, but it did show an abuse of power. Dr. Brooks was also in the movie. He played the superintendent in the film. He also required 2 things. One, that they do not dehumanize the patients in any way or make it uncomfortable for them, and 2, that patients would be hired to be in the film, and indeed they were. I think the movie was definitely a Hollywood version, but it also shows that abuse of power can get out of hand and it can be misused. There is always abuse of power. There's going to be, no matter what institution you're in. But if you make this more accessible, I believe that eliminates some of that abuse of power. Patients originally at the state hospital, when they passed away, they were buried. They were running out of space, so they exhumed those bodies and cremated them. And so they made little copper canisters, and the cremains were put in those canisters. They buried them on the campus in a drained pond in separate vaults, and they were there for many years. When somebody went to claim someone, they found out that the canisters, indeed, because they were copper, they were beginning to corrode, and they were beginning to corrode in very colorful manner and very individual manners. The story of the canisters is in a way a sad story, because it means that a lot of people that lived and died here were not claimed by their relatives and were, in essence, forgotten. Also, the canisters, I think, because of the different ways that they are corroding, show the individuality of people, that each one is different, as we all are.